Good morning from Washington. I'm Luke Russert. It's Monday, October 6, 2014. This is the Daily Rundown. We'll start, though, with the breaking news in the Ebola outbreak. The fifth American infected with Ebola has just arrived in Omaha, Nebraska for treatment. Just moments ago, the ambulance carrying NBC freelance photographer Ashoka Mukpo arrived at Nebraska Medical Center's biocontainment unit. Mukpo landed at Omaha's Epley Field less than half an hour ago in a specialized medevac jet from West Africa. His plane steered clear of the main terminal and stopped in a remote part of the airport. That's where Mukpo was moved to an ambulance and taken to the hospital where he is now. Mukpo tested positive for Ebola in Liberia last week, 2 days after being hired to work with NBC's chief medical editor, Dr. Nancy Snyderman. Mukpo contracted the virus before he began working with our NBC News team in Liberia. Mukpo left Monrovia last night, walking onto the plane with some assistance. The plane made a refueling stop in Bangor, Maine earlier this morning before finally arriving in Omaha moments ago. Mukpo's father said his son is eating and drinking on his own, which at this stage are some really good signs.
I am so relieved that he is coming back to an environment where he can get the simplest of medical care, which is intravenous fluids, that really is life-saving in the Ebola virus.
Mukpo is being admitted at the same hospital where Dr. Richard Sacra was treated for Ebola and discharged on September 25th. Dr. Sacra was admitted to a Boston hospital Saturday for an upper respiratory infection, but the CDC says he tested negative for Ebola. Joining me now to talk about all this is NBC's John Yang. He joins us live from the Omaha hospital where Mukpo just landed. And John, I saw the scene there, some folks in those biohazard suits getting him onto the ambulance. What do we know?
And that's exactly right, Luke. And I've noticed the fact that he was able to walk off the plane under his own power, even after that long flight, a good sign I'm sure that the doctors took note of. He did sit down on a stretcher once he got off the plane. Now he is here at the hospital in the biocontainment unit. There are about 40 medical personnel, doctors, nurses, other technicians who are overseeing his care. They were told his first hours, his first day at the hospital will be much like anybody else arriving for treatment. They're going to assess his condition, run a battery of tests, all to determine what kind of treatment to give him. Since there is no FDA-approved regimen of drugs for this, this treatment will be sort of customized and individualized to this case. The doctors have been in touch with drug manufacturers trying to determine what the best drugs would be to fight this Ebola. In this case, of course, the doctors here at the Nebraska Medical Center have a great deal of confidence since they did treat Dr. Richard Sacra here in September successfully. He was here for 3 weeks, discharged, and has no sign of the Ebola virus, even though he does have this upper respiratory tract infection. Also here at the hospital are Ashoka Mukpo's family, his friends, his girlfriend. They won't be able to have direct access to him, obviously, because he is in quarantine, but they will be able to see him by video conference. They'll be in a room down the hall from him and be able to talk to him. It's not quite as good as being able to touch him, but to see him in person. But given where he was just 24 hours ago, it's a lot better now than it was then. Luke?
Yeah, you can say that again. NBC's John Yang from Omaha. We appreciate it. The CDC says it is also closely monitoring 48 people who may have had contact with the Ebola patient in Dallas. Thomas Eric Duncan's condition was downgraded to critical this weekend. Family members in North Carolina say doctors told them Duncan is now on a respirator and receiving dialysis. Duncan is the first person diagnosed with Ebola in the U.S. The director of the CDC is briefing the president today. Dr. Frieden told the Today Show that experts are regularly testing everyone they believe Duncan may have come in contact with.
Every single one of those 48 people was monitored yesterday. The temperatures were taken. None of them had symptoms. None of them had fever. The key here is to keep doing that every single day.
So far, authorities say no one except Duncan has shown any signs of infection. According to doctors, 8 to 10 days after Duncan first started showing symptoms is when most people would start feeling the effects of the virus. So today, tomorrow, and Wednesday are crucial for their monitoring. Now, NBC News has learned officials could deploy CDC workers to key U.S. airports where West African flights arrive. Joining me now to talk about all this, Dr. David Heymann. He's a professor at the London School of Hygiene and Tropical Medicine. He's also worked for the World Health Organization and for the CDC. Doctor, thanks so much for being on the show.
Good morning.
So the first question I want to ask you is, we live in a very tech-savvy world now where news travels faster than at any time in our history. I had relatives calling me this weekend saying, be careful, there's an possible Ebola patient at a hospital in Washington, D.C. Some people reacted in shock that I took the Metro subway train this weekend. Is this being overblown, or is this a real serious threat in the United States?
Well, you know, there have been Ebola cases admitted to hospitals in Europe in the past. In Zurich in Switzerland, there was a patient back in the 1990s. It wasn't known she had Ebola, but they isolated her because they couldn't diagnose, and it didn't spread further. And this is the pattern in industrialized countries. There's an excellent public health system in most countries that are industrialized. They have good hospital isolation technique and can prevent infections in hospitals, and therefore they can prevent the spread to health workers. At the same time, community activities are excellent in tracing contacts.
And you've worked in West Africa. Tell us a little bit of why the virus spreads so quickly there. It's because there's conditions that are not sanitary like they are in industrialized countries. That's why it spreads so quickly in that part of the world.
Well, don't forget that there have been over 25 Ebola outbreaks in rural areas in Africa before. And they were stopped in those rural areas where it's much easier to stop them because of good community organization, village elders, village chiefs, who can help organize the population, help them understand how to work to stop the outbreak. Once the outbreak gets out of a rural area, such as happened this time, into an urban area, all those systems break down, and it's then very difficult to stop the spread.
There is an idea by U.S. Senator Charles Schumer that folks who come from West Africa via airplane should be screened. Their temperature should be screened when they arrive. You think that's a good idea?
Well, it's been shown in the past that borders can't stop the spread of any infectious disease, whether it's MERS coronavirus, which spread around the world earlier in the 21st century, or Ebola. It's a false security to say that you can stop disease at borders. You can maybe find many people with fevers who are crossing borders, and some of them may have Ebola, but many will be in the incubation period, as was the patient now in the U.S., and that will give a false security that disease is stopped when really it hasn't been.
And doctor, similar to that point is we're approaching flu season now in the United States, where a lot of people are inevitably going to have similar symptoms to Ebola, which will just be more likely than not the common flu. How much of a problem will that be? Is that people get these symptoms and they're so fearful by what they see on television? Do hospitals run the risk of being overrun?
Well, if hospitals have the proper triage systems, they'll be able to identify people who have a fever and who have had contact in West Africa or with a patient in the U.S. So it really is not a major difficulty, even though early in its stages, Ebola does resemble influenza and other febrile diseases. But with a good history of the patient, finding where they've been in the previous 2 or 3 weeks, all that can be limited to a very few numbers of people who would be suspect.
And lastly, I'll get you out of here with this, just to the mom who's watching right now, or the dad who worries about their child, riding the subway, going to an airport, going to a public food court. What's your message to them regarding Ebola?
Ebola is only spread by close contact with the person's blood or body secretions and excretions. It's not spread through the air. It's never been showed epidemiologically that this occurs, and really there's never been a virus which has been bloodborne, such as Ebola, in the past, which has changed to one that can spread through the air. So the message is there's very little risk of becoming infected with the Ebola virus through casual contact or being face-to-face, unless a person with Ebola sneezes directly into the face of someone, or unless that person touches a body secretion or body fluid of the person with Ebola.
Dr. Heyman, thank you so much for your analysis and for reminding us how difficult it is to pick up Ebola in an industrialized country that has proper sanitary conditions. Take care. If you still have questions about fact versus fiction, risks and prevention, MSNBC is hosting another live Twitter chat. An expert will answer your questions today between 11 a.m. to 1 p.m. Eastern. Use the hashtag Ebola Answers, and we hope to kind of calm down the fears we have out there. Up next.